I read your one-liner, increasing patient safety. How do you do that?
We do that by data, by using data to improve patient safety. So what we do, we come from the hospital background. We use all the data that is already stored there within the hospital information systems. And out of that data, we can make predictions on likely events for the patients that are actually in the hospital, so we can prevent adverse events that can happen there, like falls or delirium that are usually in the hospital environment. So we don't focus on something that will be there in 10 years or so from now, but we focus on the stuff that might happen once the patient gets admitted to the hospital. And then we provide the information so that the doctors and nurses can prevent it. So that's what we are doing.
And AI is of great help in this process, right?
It's what the product is about. So it's, we come from the data science background, and we use machine learning and AI to make the predictions for the patient. So we look for like 600 parameters in the patient's data, and out of that we can predict likely events that are going to happen to the patient.
And where are you present at the very moment?
So we are presently in Graz at the Krages. That's where we come from. We're actually a spin-off from the hospital. So we've developed all our algorithms within the hospital according to what the doctors told us that they need. So they came to us that delirium is really a problem. Please help us solve that. And so we developed a module for delirium. They came to us, oh, we've got swallowing disorders which are really affecting us. Please, can you do something about it? So that's how our models are developed. And as this was really successful in the Krages, they said, hey, there are other hospitals that also want that, but we're a hospital, we can't sell it. And that's why we are Predicting Health was founded. So we can also offer those services to other hospitals.
You've mentioned the word spin-off. So yes, advantages and disadvantages, right?
Yeah, we are now a fully independent spin-off. The advantage is that we can make all the decisions by ourselves. The disadvantage is we don't have any funding, so we have to get the funding by ourselves. So those are the pros and cons of that.
And what were you looking to get when it comes to funding?
So right now, we have got the good position that we've got a certified product, so C product, that is very developed. So we're really looking for funding to get into the market. We just have our first sales partner for the German market, which will be really good. He's in the ghost mode, but as we want to extend the market, we need 300,000 for the next couple of months to make a really aggressive market entry. And also for the research and development fund, we have some government funding, so we mostly cover that from this side because we work together with the medical university and other institutions really closely. But for the really aggressive market entry, because that's not, research is sometimes funded, at least in Austria, but the market entry, we need some money to do that aggressively.
And why is Slovenia important for you? It's not too far from Graz, right?
It's half an hour, 45 minutes to go to Maribor. So this is pretty close. I'm in Ljubljana, same time as I'm in Vienna. So for us, this is, and I go on vacation. It's like, so it's a mix. So when I do business here, it's like going on vacation a little bit every time you drive down the highway. So.
Yeah, drive on Slovenian highways can be a bit of a vacation sometimes.
It brings back the feeling, of summer, right. You're stuck in traffic. And
Thank you for this insight. Digitalization brings sustainability with it as well, right?
Yeah. For us, sustainability not in terms, we might save some paper, but we save the patients lots of time in the hospital. And all the costs that are involved with that and all the resources that it needs when we can prevent events like pneumonia or so. It costs lots of resources, and we can save that by preventing it. We're just predicting it before so it doesn't happen.
Any competition that you are aware of? What makes you different?
We've got competition, and we've been also in talk with big players that now roll out similar products. What makes us different is that we've got a really strong academic background. So we've got 25 publications in the field. And we know from our competitors that our algorithms are the best on the market. But now the other competitors are like 200 to 300 times our size. So it might be interesting, but the market grows. And then we think with the quality we can provide, we can get a good market share.